Hey guys, Dr. D here with Alpha Omega Wellness, and I'm really excited today that I get to chat with Esther, who's here with us. She's one of our precious clients, and so she agreed to just come on here and share a little bit about her story, what her struggle looked like, and then how she was feeling after she started doing these treatments that we do for depression and anxiety. So Esther, welcome. Thanks for coming in. I really appreciate that.
Well, thank you for having me. I appreciate it.
Of course. So tell me a little bit about just about you. I know that you're a wife and mother.
Yes, I've been married for almost 10 years.
Awesome.
To my husband, and we have he has a son and a daughter. They're a little bit older, and we have a daughter together who just turned 5. So,
awesome.
Yep, I've been dealing with depression for a very long time and anxiety since childhood.
Oh, wow.
So it's been a long journey.
Yeah.
Been on medication since I was in adulthood.
Okay.
And nothing really seemed to just take it all away, obviously. The depression, I would go down into these, episodes of depression and have to get myself back out of them through the steps that you learn through counseling and therapy and things like that. But yeah, the medication was never the solution,
right? Basically. So, how long would it take for you to kind of dig out of those episodes of deeper depression?
The deeper depression, about 2 weeks to a month.
Okay.
Yeah, it just would depend on how well I was, practicing what I should be doing, keeping my routine, whether I could keep my routine, and basically what I had going on at that time. So, sometimes it was harder than others.
Right. So how many of those episodes would you have in a year, would you say?
Probably 6.
Oh, wow.
Yeah. And it would just depend on...
This was kind of an every couple month thing then?
Oh, yeah, absolutely.
So what was your life like back then? Like, what was the day-to-day or the week-to-week like? Like, how did that depression and anxiety, how did it affect you? How did it affect your family?
Well, it affected my family a lot and myself. Basically, it was hard for me to go to work. I usually could get up, and once I got there, I'd be okay. But there were just some days you'd wake up and you'd say, nope, I can't do it. And I couldn't talk myself into it.
Oh, wow. So
that affected me a lot and my place of employment. And it affected my family financially. It affected my family where I would not be able to go to family functions because I just could not bring myself to leave the house. It got a lot worse during COVID.
Okay. You're not alone there.
Yeah, I know.
People got worse during COVID. The isolation and just the fear and... Absolutely.
And just not leaving the house as much, working from home. I kind of got into that routine, so that was my routine. So leaving the house was like very big struggle.
Right.
Yeah.
People talk about that overwhelm.
Absolutely. It is very overwhelming. I did not go to grocery stores. I ordered everything online. So it was...
You were in bondage.
Oh, absolutely.
Really? I mean, it was like your own little prison just because of the depression and anxiety. How did that affect your children, do you think?
Well, my daughter was still very young, and as long as she was with me, she was fine. But she wants to go to the park. I'm not going to the park.
Right.
She wants to go hang out with her cousins or her friends. I'm not going. So of course it affected her. So she didn't get to experience everything or even events that she would normally get to go to, and I couldn't bring myself to leave, so we're not going.
Because you were sick. I mean, honestly, like...
Yeah. Now, my husband would normally take her, but she got to miss that experience with me.
How did that affect you? Because, I mean, I would think that then
it
kind of
put me in a deeper depression.
Right.
Absolutely, because I felt like a failure.
Okay.
You definitely feel like you're failing your child at that point. You're failing your husband, and you're failing your family because you're missing out on all their major events.
So then there's the guilt tacked on top of the I already don't feel well.
Sure.
Yeah.
Absolutely.
I can relate to that. So, just being very candid, when you and I talked when you came in, you were a hot mess.
I was crying.
You were so anxious.
I was shaking. I was not in a good place at all. I couldn't go to work. I would go to work, but I would want to leave the entire time. And that's when I would leave the house to get there. I mean, I would just, the whole entire day in my brain was going, I just want to go home, over and over and over.
So how much work do you think that you would miss a month or 2 months or?
Several days a month.
Several days a month. Mm-hmm. I saw one statistic that the average person struggling with depression loses out on $7,000 to $11,000 a year of income, just from missed work or less productivity. I mean, if someone's in sales and their productivity is not, that's income that they're not bringing into the home.
Absolutely, and you're less productive at work, so it's affecting your employer who's paying you for all hours that you're there, and you're doing the bare minimum because you can't push yourself to go any further than, okay, that person needs this right now, so I'll do this, but that can wait.
Right.
And you're procrastinating, and it affects your home because you're doing the same thing at home.
Yeah.
Like, oh, I'll just let that pot pile up over there. It'll be fine. So basically, I've now got like 2 years of paperwork that needs to be filed in our filing cabinet, and I just keep pushing it off because I don't have the motivation to do that.
Oh, I remember that I had a spare room in a house that I was renting. And I just, the bills, the paperwork, I mean, it was just like, that was the room that you just don't go into.
Catch-all, yes.
Right, because you just don't feel emotionally prepared to handle that.
Absolutely. Mine, it's the kitchen counter and the kitchen table. Yeah. Like everything just piles up there, and then you end up eating on the couch. And yes, you're still with your family eating on the couch, but then you've got the TV on and it's distracting you. You don't get the same experience. Yeah.
So then you came in here and we started talking about these treatments that we do. And you decided that it was worth giving it a try. What was the thing that made you decide, you know what, I'm going to give this a shot?
Well, when you told me about the treatments, you let me know that no matter the cost, you're going to say it is so much, it's worth so much more after the fact. And look how much money you're missing out on by not being able to go to work, by not being able to do these things with your family. So you're not just missing out financially, you're missing out on everything.
Yeah.
You know, I wasn't able to go to church and experience that. And I'm very, connected with Jesus, and I want that relationship with him. So that was really hard. The guilt of that as well was very hard. And you said, people say they can't afford to do this, which was what I was telling you to do. But really, they can't afford not to do it. And when you told me that, I thought, you're right, we should give this every chance. This could be my one chance. I'm living with this. I've been living with it for so long. Why not take a chance?
And that's my whole thing. I think people in general, not just this, but whatever that is, we don't count the cost of not changing.
Right, absolutely.
But there's a huge cost there.
Mm-hmm.
Like, if you could have paid $25 to feel well enough to go to your daughter's event in that moment,
yeah, absolutely, 100%.
you would have done it, right?
Absolutely.
So there was a dollar cost of that value that you were missing being able to do that.
Sure.
That if you could have fixed that in the moment, you would have, right?
Absolutely.
2 hours of relief, and then, so I
go
think...
back to my bed.
Yeah, I just think a lot of times we don't think about how our mood and anxiety is affecting our spouse and our children and our friends and this whole network, right? It's like you drop a pebble into the pond and there's that ripple. And oftentimes, especially when we're in the throes of depression and anxiety, we're not even thinking about how far those tentacles reach.
You're not thinking about anything but yourself at that point.
Because that's all you can really try to do
You
to get
feel
through.
sorry for yourself the entire time.
Yeah. So everybody else just kind of has to roll with it.
Yep.
So tell me, as you started these treatments, what did you experience? Like what results did you start seeing? How long did it take you to see positive results?
I did see positive results almost immediately. I mean, the next day after having the first treatment, I was able to go to work. I was able to go to work and not once think, I want to go home.
That's incredible.
And I think I said to you, I feel like I have a hanger in my mouth.
Yeah.
Because I was smiling like this and I couldn't stop. I tried not to cry because it was amazing. It felt amazing. I don't know how else to describe it because it was almost immediate.
Yeah.
That I felt relief and felt so much better.
And before that, did you even think feeling like that was possible?
No. I didn't know what feeling normal felt like. It was almost scary to me.
Wow.
Like, is this normal? Is this what people,
This is what people
do people
feel?
lay down and not think random things in their head? Like, why does McDonald's give you coffee that's so hot you can't drink it till that evening? You know, like,
Yeah.
and go down the rabbit hole. People actually lay down and go to sleep. That's insane.
Yeah, because so many people struggle with that brain chatter like you're talking about, or they struggle with just this negative self-talk,
Sure,
this
absolutely.
self-judgment,
Yeah.
you know, and that keeps our brain fired up. And so, yeah, that's just incredible. And I thought that you started noticing changes right away. But kind of take us through, like, what about later in the treatments or at the end of the 6 treatments? Like, how were you at that point?
Well, throughout the treatment, and it seemed like with everyone that I would feel better for longer. You know, my treatments were spread out a little bit longer than I think some other people. So I would kind of, you know, get that anxiety a little bit there toward the end, towards the next appointment. But by the end of it, I wasn't getting there.
Yeah.
And the span between the 5th and the 6th was obviously the longest I had gone, and there was none. And I felt so amazing, and I was able to go to things. I didn't miss any work. I felt great, and I kept telling people I feel great, and I had a smile on my face all day. So it's really just been a total life changer.
So
Complete change.
what's been the biggest shock to you about this new version of you?
I don't know. I can tolerate things so much better. I'm not as irritable, obviously.
Like, even when things don't go great,
Yes,
you just have resiliency.
absolutely.
Yeah.
I've been telling you that as well. Something that happened personally in my life that normally I would spiral at that point. I didn't. I literally just handled the situation. You know, it made me upset for a minute,
Right.
and then I moved on,
Which is normal.
which I didn't know that was normal.
Right.
I thought you dwelled on it for 12 days.
I've got a quote here from you that I pulled up.
Okay.
So you'd had 2 treatments, so this was before your 3rd. I feel really good. I feel a little better each time. I haven't smiled this much in forever. And that's when you told me that you felt like that you had a hanger in your mouth. And you were only a third of the way through the treatments, but you said, I can't stop smiling.
I know. I was telling everyone I knew about it because I thought if this could just help one other person,
Yeah.
and I told them about it, how good would that make you feel? You know, so you just have to feel great because
Right.
you're helping so many
Absolutely.
people. Absolutely.
Which is one of the reasons you agreed to come in here and
Yeah.
get on camera for us, just to help people understand like where you were and where you are now.
Absolutely.
So-
because I would have never been able to do this. Never.
Yeah, I'm so proud of you. That's so awesome. And I just love your smile. Has anyone around you said that they notice anything?
Absolutely. My husband,
Yeah.
100%. He's like, I just notice how, productive you are.
Yeah.
You have the motivation to do things.
Yeah.
And where, had my sister set me an itinerary,
Yeah.
I would have said, there is no possible way you're getting me to do 3 things in one day.
Right.
I was like, okay, I embrace that. Let's go. Because normally doing one thing a day, leaving my house one time was exhausting for me. And I couldn't do more. Even the next day, it was like, I'm not leaving the house. So now I can leave the house every day.
Yeah.
And
in theory, you'll earn more money this year because you're at work and more productive, or you're at least not earning through vacation days.
Yes, exactly.
And so that's time that you'll actually get to use with the family, feeling great, smiling.
I know, we're about to plan a vacation. I actually
love it.
get to use vacation days and not feel like, oh my gosh, I have none for the rest of the year that I'm going to call off.
Right.
So I feel great about it, and I can't thank you enough.
Thank you. So, Esther, if there's an Esther out there who's watching this, who is struggling with that just cycle of like in and out of depression and constant anxiety, and they're looking for a solution, what would you tell them? What would your advice be?
The same advice you gave me. You can't afford not to do it because you're missing out on your entire life. Your family's missing out on your entire life. You have to do this. It will change your whole entire life. You will feel like yourself again. You will be yourself again. And that is worth everything.
You might not even know what that remember what that self looks like anymore.
No.
Yeah.
My husband just kept saying, I want, he calls me nickname Noodle.
Yeah.
When we met.
Yeah.
And he's like, I want my noodle back.
Oh. And is Noodle back?
Yeah.
Praise the Lord. Oh my gosh. I just love it. I just love it. Well, is there anything else that you think that we didn't cover?
No, I think that kind of sums it up.
Okay.
Like, it's a complete 360 for my life and for my daughters, who now gets to know her real mom.
Well, and that's the thing. Like, you're going to change how she's growing up. And so what you did, this investment of your time and your resources, it's going to impact your grandchildren.
Absolutely.
And great-grandchildren, right? I mean,
Absolutely.
We talk about generational blessings, and I think that's just beautiful.
Yeah, break the cycle.
Yeah, but you had to be willing to step out of your comfort zone and do something
100%.
different and take a risk and have faith in my medical decision making and my leading you to something that I knew was going to help you.
I mean, I don't know. It had to have been God's grace to get me to come in here and do it, because I would have never imagined that I would pull the trigger on that.
And then you wouldn't have imagined feeling
I
like
wouldn't have had this life.
Yeah.
Yeah.
I love it. Well, God bless you, Esther.
Thank you.
Thanks for coming in.
No problem. Thanks.
So I hope you guys found that discussion very helpful for you. I'm very passionate about these treatments that we give because obviously I just see such a huge difference in our patients over a matter of just a few weeks. We find that we consistently see a reduction in depression and anxiety scores by about 75% in just 2 or 3 weeks. And so if you or someone you know is struggling with depression, anxiety, PTSD, please reach out to us at 317-300-4091. You could call or text that number. Please remember to hit the subscribe button here so that whether it's the podcast or the YouTube channel, you're subscribed so I can keep bringing you more and more good content. And you can always feel free to just shoot us an email as well, Dr. D at alphaomegawellness.com. But we'd love to have an opportunity to just sit down with you and chat and see if this treatment is a good fit, so that you can see the changes that our other patients are seeing and so that you can become our next success story. So God bless you guys. I love you. Let me know how we can help you.